Jock itch, medically known as Tinea Cruris, is a common fungal infection that affects the skin of your genitals, inner thighs, and buttocks. It's called jock itch because it's commonly seen in athletes who sweat a lot, but anyone can get it. The most common symptom of jock itch is intense itching in the groin area. The itching can range from mild to severe and may worsen with activity or sweating. Affected skin may appear red or pink in color. A rash may develop in the groin folds, spreading outward in a circular or oval shape. The rash may have raised edges and clear in the center, resembling a ring. Some individuals may experience a burning sensation or discomfort in the affected area. In severe cases, the skin may crack or peel, leading to flaking or scaling. Jock itch is caused by a fungus called dermatophytes, which thrives in warm, moist environments. Factors that can contribute to the development of jock itch include excessive sweating or humidity in the groin area creates an ideal environment for the fungus to grow. Wearing tight-fitting clothing or undergarments that trap moisture and heat can promote fungal growth. Failing to keep the groin area clean and dry increases the risk of fungal infections. Sharing towels, clothing, or sports equipment with someone who has jock itch can spread the infection. Individuals with weakened immune systems are more susceptible to fungal infections, including jock itch. Diagnosing jock itch usually involves a visual examination of the affected area by a healthcare professional. In some cases, a skin scraping or culture may be performed to confirm the presence of the fungus. Differential diagnosis may be necessary to rule out other skin conditions such as eczema or psoriasis. Topical antifungal creams, lotions, or sprays are commonly prescribed to treat jock itch. These medications contain active ingredients such as clotrimazole, miconazole, or terbinafine, which help to eliminate the fungus and relieve symptoms. In severe cases, or when topical treatments are ineffective, stronger antifungal medications may be prescribed by a healthcare professional. These may include oral antifungal medications such as fluconazole or itraconazole, which are taken by mouth for a specified period. Prescription-strength topical antifungal creams or ointments may also be recommended for more aggressive treatment. In some cases, jock itch may extend to the nearby areas, such as the buttocks or inner thighs. In such instances, using a medicated shampoo containing ketoconazole or selenium sulfide can help treat the infection and prevent its spread. These shampoos are typically used in the same way as regular shampoo, with the lather left on the affected area for a few minutes before rinsing off. Preventing jock itch involves a combination of good hygiene practices, lifestyle adjustments, and taking precautions to minimize exposure to the fungi responsible for the infection. Shower regularly and dry the groin area thoroughly after bathing, paying special attention to skin folds and creases. Choose loose-fitting clothing made of breathable fabrics to allow air circulation and minimize moisture buildup. Applying antifungal powders to the groin area can help absorb moisture and prevent fungal growth. Refrain from sharing towels, clothing, or personal items with others to reduce the risk of spreading fungal infections. Wash workout clothing and towels regularly and avoid wearing damp clothing for extended periods. If you found this video helpful, don't forget to like, share, and subscribe for more informative content. Stay tuned for our next video.